Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Putri Rahmani and my partner, Siva Shafira, going to presenting our case report about developing self-aware mindfulness to manage mood disorder in adolescents. This is a case report of 22 years male with suicide attempt on major depressive with psychotic symptoms. This is the abstract. As an introduction, as gleaned from the literature, self-awareness is self-concept behavior, such as being fully vibrantly alive in the present moment, exercising self-control, and reacting self-awareness to self with qualities and mindfulness. This is patient medical history. He is 22 years old, male, and he's lived in Cimahi. On the 2019, he's graduated in high school and accepted as an army 3 years later, and now he worked at the lighting department. And he found out that he felt exhausted with the work environment on January, and the next month on February, he experienced an auditory hallucination and depressive symptoms. And the next month again on March, he tried the suicide attempt and be hospitalized. This decision of hospitalizing patient was the right indication for the hospitalized the MDD because of the patient we found psychotic symptoms and then the suicide attempt. And the biopsychosocial analysis on the patient, we might found the neurotransmitter imbalance on the patient, and the psychological side, we found the stressor and patient coping mechanism is repressive and dependent personality. On the social partnya, there's a problem on the workplace. Next. On the physical examination, we found the mood and affect depressive, hypoactive, autistic, sense delusion, suicide thought, and auditory hallucination.
Okay, the next one is the diagnostic axis. From the axis 1, we found the major depressive episode with psychotic symptoms. And for axis 2 and 3, we couldn't find the diagnostic. And for the axis 4 is problem with his workplace. And the axis 5 for the global assessment functioning, the score is 20 until 11. And the next one is the diagnosis criteria that we found in the patient symptoms. There should be 3 main symptoms of depression must be present that shows from the patient is feeling of sadness or hopeless, lost interest and ambition, fatigue, and reduced motor function. And the other one should be 4 until 7 depressive symptoms must be present of severity intensity. From the patient, we found the concentration, attention, decrease, feeling less confident, sleeping and eating disturbed, thought of suicide, death, or self-harm. And there are psychomotor agitation symptoms, and this onset of the patient, it shows 2 months on the patient. That should be at least 2 weeks. And the patient has a limitation in doing homework and social activities, and there are hallucination that show in this patient is auditory hallucination, which are sounds the patient is asking him to end his life. And the next one is the patient treatment for the pharmacology that we found in the guidelines. The patient with psychotic picture for the first line is SNRI in monotherapy or SSRI that combined with atypical antipsychotic, and we chose atypical antipsychotic is quetiapine with 50 dose until 150 milligram per day. And the other one is the SNRI that we give as escitalopram. And the other one, we combine the pharmacology with non-pharmacology. We give to the patient a psychotherapeutic intervention. There are cognitive behavioral therapy, interpersonal psychotherapy, and behavioral therapy. And this is the patient monitoring for day 1 until day 5. There is an improvement mood, and we couldn't find the auditory hallucination. This is the discussion. What is depression? MDD with psychotic is complicated affective disease. This is who is affective depression. Depression affect people differently. Women are more often affected, and adolescents are the largest demographic effect. And this is the suicide attempt management that we can give to the patient: screening for suicidal ideation, performing assessment, and creating treatment. This is the conclusion, and this is the reference that we create. And this is our team. Thank you for your attention.